Hello, everyone, and thank you for joining us for this overview of the Medicare Depression Screening Benefit. My name is Mary Moko. I am one of the specialists on the Provider Outreach and Education, or PO team, at WPS, and I'll be your speaker today. Assisting me is my PO friend and colleague, Bailey Lawson. I do have some housekeeping to share with you before we get started today. We do have training materials available on our website, so if you've not yet downloaded the presentation for today's event, you can do so by going to that training center webpage. And I see that Bailey's putting some information into the chat for you as well. It is on our live events webpage where there is a link to the presentation materials for today's event. You can send your questions and comments in chat. And of course, following our event today, you'll be able to tell CMS and WPS how we did on a brief survey garnered specifically to get our learners' feedback. We begin our event today with this disclaimer. We include this disclaimer in all of our education, and we do so simply to remind learners that although we made every effort to provide current information that is absolutely correct, the information is subject to change. It is on the CMS website where you will find those laws, regulations, and rulings that determine final coverage, and it is these that will always prevail. Just as a reminder, CMS does prohibit recording of this presentation for profit-making purposes, so we've included the photo or the little graphic here on the left side of the screen asking you to not record our presentation today. We are recording it, and we will upload it to our Encore Presentations webpage as well as our YouTube channel following this event. It may take just a few days to get it out there, but please be assured that absent any technical issues or difficulties, we will be uploading that. So here is the agenda for today's presentation, and this should look really familiar to all of you because this is exactly those words that I used to advertise this event today. This event is really designed as an overview. It's a basic overview of Medicare's depression screening benefit. And within the next 60 minutes, I'll be sharing with you the coverage criteria, documentation requirements, some information about billing and payment, and I am going to, of course, provide you with several resources that I hope you'll find helpful. And I'm going to conclude with answers to your questions. Those questions today should pertain to the information that I am presenting during this live webinar today. So I'm going to begin today by discussing coverage criteria for Medicare's screening depression benefit. It is in a national coverage determination, or what we call an NCD, that CMS explains coverage for the screening depression in adults benefit for Medicare beneficiaries. This NCD, the number is 210.9, and you can see that right here. What I'm showing you is a screenshot from that actual NCD. It's effective for claims with dates of service on or after October 14 of 2011. So this has been in effect for quite some time, and you can see the effective date and the December 27, 2011 implementation date in the tracking information of this NCD, and it is found in CMS's Medicare coverage database. The Medicare coverage database is a national searchable depository of all Medicare policies, both those national coverage determinations as well as the local coverage determinations. Now, I've included an embedded link in the presentation materials that I made available for download, and you can see by the underlining here of the title on this slide that is your embedded link. You can simply click on that and it will take you directly to that NCD. So based on that national coverage determination that CMS wrote, it applies to all MACs, not just to WPS. CMS provides coverage of this benefit for anyone that's eligible for Medicare. This service is a screening only. It is not available for those that are already diagnosed with or those that are being treated for depression. If a patient presents to your office and has those symptoms of depression, it's really not a screening then. So this benefit is available yearly. There must be 1 year between screenings, and you can find that information in that national coverage determination that I just talked about. CMS's NCD also states that in order to be covered, the screening must be provided in a primary care setting with staff-assisted depression care supports to ensure accurate diagnosis, effective treatment, and follow-up. You can see that right there on this slide. So CMS does have a description of a primary care setting, and this is actually found on their website. Bailey has placed the link to the CMS Preventive Services Quick Reference Chart, specifically the depression screening entry in that chart, and I'll show you what that looks like right now. I'm going to pull it over so you'll see the website information coming over onto your screen. This is that Medicare Learning Network educational tool for Medicare Preventive Services. This is one of my favorite offerings of CMS's because it has a lot of great information in a simple way to find it. So right here is the depression screening choice. But for those of you that, I know we're listening today, we're talking specifically about depression screening, but if you bill any other preventive services, this is a fantastic educational tool that CMS has prepared for you. Very well done. So if you click on depression screening, and you might might wonder what that T is that's circled. You see T on some of these other preventive services also that you can click on for more information. A T indicates that telehealth is available for that service. So if you click on the depression screening, what you're going to find then is the information that is specific to depression screening. So this actually links you to that national coverage determination that I had screen prints of in my presentation. Just an easy option for you to go over here on the right side and print this information. But remember, it might change. So you want to be careful whenever you print anything from either CMS's or WPS's website because the information is subject to change. I like it that they put this little balloon in here and asks, or they address rather, what's changed. Starting in 2025, depression screenings can be delivered through telehealth. So good to know, something up front. There are links embedded here in this tool to find the CMS ICD-10 webpage, and of course ICD-10 codes are those codes that report on a Medicare claim the diagnosis. You can also link to find your MAC's website and of course your MAC if you submit Part B and Part A services in Iowa, Kansas, Nebraska, and Missouri, or Indiana, Michigan is WPS. And of course we have our legacy Part A states as well, scattered mostly throughout the entire United States. Not quite though. This tells you the coverage information, frequency information for depression screening. I like it that they have this link that has frequently asked questions on how you can check eligibility. Remember I said earlier that CMS allows this screening once per year. It addresses what the patient has to pay. There's some other notes in here. I like it that CMS has made the changes or the updates in red colored font. So you can see those changes there, and specifically this addresses those 2025 changes in that this can now be delivered in a primary care setting or through telehealth. Okay, so this addresses the place of service for telehealth. When you're billing telehealth, use place of service 10 when the service is through telehealth and the patient is located in their home, but use place of service 02 when providing the service through telehealth and the service is provided somewhere other than in the patient's home. Here are FAQs at the bottom, and I really came to this page to show you this. Right here on the bottom right side of the page, what's a primary care setting? So it tells you that CMS defines a primary care setting as a place where clinicians deliver integrated, accessible healthcare services and are responsible for addressing most patient healthcare needs, developing a sustained patient partnership, and practicing in the context of family and community. So CMS goes on to say then here in this educational tool, those services that they don't consider as a primary care setting. You can see some examples listed there: emergency departments, ambulatory surgical centers, diagnostic or independent diagnostic testing facilities, skilled nursing facilities, and so on and so forth. So if you're ever looking for that definition of primary care setting, because CMS does have rules for some other services also that must be in a primary care setting, this is a great place to come back to, because this is where CMS defines primary care setting. All right, we are going to go back to the PowerPoint now. And I'm going to start beginning, or I'm going to begin to talk about documentation. So what needs to be included in the documentation in order for Medicare to consider coverage for depression screening? Documentation must include the tool used by the provider for the actual screening itself. This would also mean that you should indicate in that documentation the administration method for that tool. Document the time, and this needs to be in minutes, to administer the screening and interpret results of the screening. Be specific. Do not use words such as over 5 minutes or between 5 and 5 minutes. What you need to do is state in that documentation and that medical record, state or show the time in exact minutes. You can do this by using words or start and stop times. But what we're looking for is the actual number of minutes, not 5 to 15 minutes, not over 5 minutes, but specific. Now, in the record, you should also be certain to document the use of the results of the screening by the healthcare professional who is billing for the service, not the healthcare professional administering the service, although it might be. But sometimes other healthcare professionals or staff within an office actually administer the tool. What we're looking for is documentation, the use of those results by that individual who is billing for the service. Now, this means that there should be a plan of care. Of course, if there's negative findings, it's not going to be very lengthy, but for positive findings, it would be more lengthy, of course. And what we're looking for here is that you document findings, both positive and negative. I'll expand on the negative results a little bit more later in this presentation. Let's talk individually about these things now, what it is you need in the depression screening medical record, beginning with tool. I'm going to pause just for a moment here. All right, thanks for hanging in there with me. There are many depression screening tools that are available to providers, and it is that CMS really does allow the provider to choose which tool is best for his or her practice. We do not recommend, nor does CMS recommend, one tool over another. Remember, you're going to need to document the tool used and how it was administered, but it really should be up to the provider to choose their screening tools, those that make most sense to their clinical practice and their patients' needs. Now, the American Psychological Association's website does contain a list of various assessment tools. The tools that are on the APA's website or on that list include both those that are interview and those that are self-report measures for screening. Now, most tools are available on their website at no cost, and they are indeed proven effective or proven valid and reliable. Medicare pays for depression screening with the use of any tool. Let me reiterate that. But all criteria for payment must be met. So again, we do encourage clinicians to review evidence-based literature about tools before choosing one so they can make an informed decision about what's best in their clinic or in for their clinical practice and of course their patient needs. Here are some questions to consider asking. These might help choose a tool that's right for your practice and your patient needs. Is the tool self-administered or is it an interview? Is it age relevant? What is the total time to complete the assessment? And one last question we've included here is that tool designed to diagnose or screen? Remember, this is a screening benefit. It is important for providers to recognize that higher or more detailed screenings do not get greater reimbursement. The reimbursement amount is the same regardless of the tool that you use. So when determining actions based on the findings, you're going to need to follow all necessary steps for treatment, and you're going to need to include this in your documentation. Again, something that we say often, the content of the documentation is more important than the time taken to administer this service. Remember to document all those required elements of the service or required criteria, I should say, that payment criteria to make it covered. I'm going to expand a little bit more right now on documenting time because we do get a lot of questions about documenting time. As mentioned when I talked about it earlier, you need to document the time in minutes spent on administering the tool by staff that's trained to do so. The minutes in the documentation should also include the time spent analyzing or interpreting the results. And of course, that's going to be done by that professional who's billing the service. Include the time spent adding the screening results to the patient's medical record. And finally, include the time used by that billing provider to use the results, whether positive or negative. Of course, for positive results, and I mentioned this earlier, there's going to be that plan of care. But what if the results are negative? There should be what our contractor medical director calls proof of thought. You can see that in quotations here on this slide. This is documentation that the professional acknowledges or understands and considers when the screening is negative. Our CMD likens it to an EKG that a provider orders. Well, he or she doesn't actually interpret that EKG. He or she does indeed consider the findings or the results when making medical decisions for his or her patient. So something that you need to be aware of, we're looking for that proof of thought even when the results are negative. This slide expands a bit on what we expect to see in the documentation for the plan of care. For negative findings, we would expect to find evidence that no further action is planned, but there indeed was consideration of that negative finding. There was proof of thought. Now, if findings are positive, Medicare would look for documentation to support any additional evaluation and management that's planned for that patient. You know, is there suicide risk? Is the patient being referred for treatment? Is pharmacological intervention occurring? Is there other intervention or treatment planned for this patient based on those positive findings? And finally, Medicare would expect to find documentation of the patient's response and their willingness to follow the plan of care. Here are some helpful questions to help a provider decide the need for referral. And I'm not going to go over each of these individually. You can take a look at them and read them. But what we were recommending is to ask questions like, does the patient feel sad or empty? Does the patient show decreased ability to think or to concentrate? All of these things or these questions here on this slide would be helpful in deciding the need for referral of that patient based on those positive findings. Here's one last question that I've included that might help decide need for referral. What disease process is present and that could be that underlying factor as it relates to depression? We've added here on this slide that um, for older adults, depression could exist if there is an underlying factor such as or disease, cancer, arthritis. You could see chronic lung disease listed here and so on and so forth. So what disease process is present that could be that underlying factor that relates to the depression? All right, we've talked about coverage. I've talked about requirements for payment, what it is you need to include in your documentation. Now I want to talk about billing and payment for depression screening. CMS established a HCPCS or Healthcare Common Procedure Coding System code G0444 to report annual depression screening 5 to 15 minutes. And while the entire list is not manualized, we have confirmed that Medicare does cover depression screening in certain places of service when reported on your claim form. And this isn't on your slide. I apologize for that. I didn't place it on there or think to do so, but when I was reviewing materials for this, I thought, it would be helpful to give you the actual places of service that WPS considers as a primary care setting, because CMS has this information in their manual except for some of these services. I did contact CMS and ask them about additional places services that are not yet manualized. And when I talk about manualized, what I'm talking about here, folks, is those internet only manuals that CMS publishes on their website. It is in the IOM that CMS tells us specifically which two-digit codes represent those places of service for annual depression screening. So that would mean it's a primary care setting. They are office 11, off-campus outpatient hospital 19. That's not yet manualized by CMS, but I confirmed it. Outpatient hospital is 22, place of service 49, indicates independent clinic. A state or local public health clinic is place of service 71. And telehealth, of course, it would be place of service 02. If you are looking for place of service information, I'm going to pull this over here and share it with you right now. I'm going to go to the WPS website real quick. This is our home page, of course. But if I'm looking for valid place of service codes, I would start typing into the search box. I'm a searcher, folks, not a navigator. So I use search most all of the time because what our website does for you to make it more easy, especially if you've visited a page before, is if there's a match, it will place a suggested match in a list that drops down, and you can simply hover over and click on the page that you want to go to. So because I often go to place of service codes for professionals, right here, I didn't even have to finish typing in place of service codes. I have a match. I'm going to choose it, place of service codes for professionals, professional claims. Here are those two-digit place of service codes in column 1, along with the name of that place of service, and then a description. And these are actually not WPS's codes, but CMS's codes. So these are those that are also reflected on CMS's website. Okay, and I asked Bailey to place into the chat that place of service information since I didn't get it out there on a slide. And what I will do following today's webinar is send that to all of you that are participating in this live webinar following today's event so that you have it in an email, you can tuck it away. Because some of those services, those places of service, are not yet manualized. They're not yet in that IOM. And by the way, when I contacted CMS about this, they did say that the next time they update that portion of the internet-only manual, they will include those places of service. And remember that this service for 2025 is on the list of CMS approved services that can be delivered via telehealth. So you will find that G0444 out there. Looks like I lost track of my website or my PowerPoint here. There, it's back. All right. So we can move on, and this is just, because this portion of the webinar is billing and payment, I wanted to delve a little bit deeper into that frequency. I told you that Medicare will cover annual depression screening annually. This slide expands on that frequency for coverage. CMS views 1 year between screening as 11 full months having passed following the month in which the screening occurred. So I've included an example here on this slide. If the screening occurs on July 12th of 2024, the next available date for screening when the Medicare claims processing system will allow G0444, again, based on frequency, not on the other coverage parameters, of course, but all of that would need to occur, is July 1 of 2025. So 11 full months having passed following the month in which the screening occurred. Now you can check patient eligibility to view the date of the last screening. You can do so by using the CMS Health Insurance Portability and Accountability Act, or HIPAA, Eligibility Transaction System. That's a lot to say. We call it HETS for short. So if you see the acronym HETS, H-E-T-S, what we're talking about is that HIPAA Eligibility Transaction System. You can use an eligibility services vendor or the WPS Secure Net Access Portal, or what we like to call SNAP. You can access SNAP on the WPS website. I'll bring this over and just give you a quick look here. If you are on any page of our website and you want to go back to the home page, just hover over the logo in the upper left-hand corner and click on it, and it takes you back to the home page. So this is where you can find information about registering for, if you're not already a user of SNAP, the Secure Net Access Portal, or this will allow you, of course, to log in and view that eligibility information. Just as an FYI, I know that we have had some webinars held recently about viewing eligibility information on our SNAP. But if you're looking for instructions and you don't want to look at that video or hear about it, you can click right here on the Portal User Manual. This is the Portal User Manual for the Secure Net Access Portal. It includes illustrations and also step-by-step instructions, not just for looking at eligibility information, but on all of those functionalities that are offered by our SNAP. Another way to find that user manual is to scroll to the bottom of any web page on our website and look under Educational Opportunities here in this blue box and choose Portal User Manual. Okay? So just some ways to find that very important Portal User Manual, illustrations and step-by-step instructions. A lot of great information there. All right, we talked about frequency, we talked about the code. I want to talk a little bit about bundling. Sometimes reimbursement for G0444, depression screening, annual depression screening, bundles into a payment made for other services that are provided on the same day by the same provider. CMS started the National Correct Coding Initiative, NCCI, program to promote correct coding of Medicare claims. So providers should use the Medicare National Correct Coding Initiative procedure to procedure edits. Sometimes we call those PTP edits, to determine when bundling of two codes occurs for a Medicare beneficiary that is seen by a provider or rendering the service during the same encounter on the same day. These edit files include a column with the correct coding modifier indicators, which indicate whether an NCCI procedure to procedure associated modifier allows that procedure to procedure code pair to bypass any claim processing edits. So this slide includes an embedded link to those procedure to procedure edits, in addition to the linked For the edits, CMS is published on their website, and I always like to show these really helpful guidelines. Let me try to pull it over here, and it just won't click and grab. A new tab. Go to the CMS website real quick. CMS.gov is the CMS website, of course. And how to use the NCCI. I'm just going to stop right there because I know it will bring back what I'm looking for. What I'm looking for is a tool called How to Use the Medicare National Correct Coding Initiative Edits or Tools. This is another one of my faves. This is the MLN education tool for using NCCI. And what I just mentioned to you is that for procedure to procedure edits, and this tool walks you through the steps to look those up. We also have helpful videos of recordings that we've done on past webinars to help you use these tools. But I'm talking about the PTP code edits, or those procedure to procedure code edits. There are also other types of edits that are part of the NCCI initiative in order to promote that correct coding. But I just mentioned to you those procedure to procedure edit pair modifier indicators, or correct coding modifier indicators. And these are what we're talking about here in column 1. CCMI stands for correct coding modifier indicators. If you look up an edit out on the CMS website following these guidelines, and you find a 0 in the correct coding initiative indicator, or the modifier indicator column, a 0 means you have 0 chance of ever having payment made for those two services that are provided to the same patient same day. If there's a 1 here, it means you can use the associated modifier when appropriate. And then a 9 means that there is no active edit. But these are a little bit different. These edits set up for procedure G0444, and I'm going to talk about that now. This slide shares that bundling status for services that are commonly performed with depression screening. We do get a lot of questions about this. Does Medicare separately pay for depression screening when rendered on the same day as this code or that code? So I'm including that here in this presentation for you. For both of these services indicated here on the primary bullets, the initial preventive physical exam, which is the IPPE, submitted to Medicare with G0402, and the annual wellness visit, AWV, the initial one, which is HCPCS code G0438, there is absolutely no modifier to unbundle and allow payment for these services, because in that CCI tool I just talked about, or in the edit you look up, there is a 0. We will not pay for the screening depression service when it's rendered same day as an IPPE or AWV initial service. The reason is because those two services, G0402 and G0438, have a required element or component in them that is already depression screening. Okay, so we don't separately allow payment for depression screening because it's already a part of these services. So payment is bundled. No modifier overrides it. Now, for the subsequent AWV, you will not find the depression screening element listed as a required element of the service. So we will allow separate payment for G0444 if it's billed on the same day by the same provider during the same encounter for the same patient, and there is no required modifier. That is how this edit, or this is set up in the National Correct Coding Initiative edits, and in the what I want to say, the MCS, the multi-carrier system, which is the claims processing system for all Part B claims. The Medicare Wellness Visits education tool is another one of those great CMS Medicare Learning Network products that describes the IPPE, the initial preventive physical exam, the annual wellness visits, both subsequent and initial, and also includes information about routine physical exams. I've embedded a link to this tool for you. I know that some of my colleagues have been offering recent webinars that delves into these procedures if you're looking for more information on those. And remember, because we record our live webinar sessions and make them into recordings on our YouTube website, you should be able to find them out on the YouTube channel as long as the information remains current, or we otherwise determine that we need to remove it for one reason or another. I want to talk just a little bit about this service, G0444. When rendered by the same provider for the same patient during the same encounter, uh, in addition to evaluation and management services. For these E&M services that are rendered on the same day as a depression screening, you are going to need to look at those edits to verify if Medicare allows the use of a modifier, an NCCI associated modifier, to unbundle that service. Okay, so by reporting a modifier on the claim, it would mean that you're showing a separately billable service is being reported, and your documentation justifies that. And remember, check those edits to verify if Medicare allows the use of that column 2 code on the same day as the column 1 code. And those indicators that I'm talking about are these CCMIs, those correct coding modifier indicators. So these are those that you would use to determine if the claims processing system will allow you to append a modifier. But remember, just because you can doesn't mean report it. If your medical record documentation justifies it, then you can report it. Okay. All right. Moving on, just a little bit of information that we do like to include whenever we talk about patient or whenever we talk about depression screening, and that is patient liability when this service is being rendered. We always include this information about patient liability when we're talking about annual depression screening, because for this benefit, the annual depression screening benefit, Medicare waives the deductible and the copayment for screening. However, it is important to recognize that if there are other Medicare covered services that occur during that same encounter, there may be deductible and copayment that applies for those other covered services that are occurring during the same patient encounter. Some examples are listed here on the slide, specifically on the bottom. Treatment of depression, because you might screen the patient and then provide treatment for depression based on the results, and if the provider is one that's not going to refer to someone else for treatment but decides to move forward with treating the patient's depression. Evaluation and management services is another good example. A lot of times if there's an office visit for any other reason not related to depression screening, patients don't recognize that they are indeed responsible for that copayment or deductible for the E&M service portion of that encounter. Diagnostic services is also a good example that is listed here. So we do recommend that you make efforts to provide this information in advance to your patient and do it before providing any services to the patient. They do not always understand that a deductible and copay are applicable to those other services that are being performed on the same day. They might read somewhere in some educational poster and such, or even posted within an office or clinic that depression screening is a free Medicare service. But they don't read the small print that says, if you have another medically necessary service on the same day during the same encounter, you may be billed for that deductible and coinsurance. So if you explain this to the patient before any service is provided, it may clear up some confusion for that patient and avoid some unpleasant trees later when they come in to discuss why they're being billed for a service they thought was free. All right. Resources and tools. I've included some here available for you. I am going to show you these. I think they've got a lot of very, very helpful information. Out on WPS's website, we have a depression screening fact sheet, which I've just opened here because I embedded the link to it. You can see the print icon here if you want to print this. But remember, things might change. We have this fact sheet out available on our website. And really, folks, this includes much of the same information that I'm just delivering to you in this live webinar today. We talk about the tools. We have those questions that I included in the presentation materials. Here it talks about time, document time, administering the tool, interpreting results, adding the results to the record, and make sure that you address the time spent by that professional that's billing uh, for using those results, positive or negative. And this, folks, is that proof of thought that I talked about earlier. Here's talks about plan of care and follow-up, billing. A lot of this, like I said, was the information that was in my presentation. And here are those covered places of service where I said I would send you an email, but if you remember, they're here on this page. You'll already have them. And Bailey also entered them into the chat. This addresses unbundling, has a link to that PTP edit webpage, services on the same day as G0444, and then some information about liability and depression screening, and links to CMS's information about this particular service. Depression screening training is also available on our website. Really very, very similar, but a lot of resources, heavy on the resources here. And the one thing nice about this page that I like is that you can link directly to our YouTube depression screening playlist. We have a playlist with links to many of the live sessions, now recordings, for depression screening education that we have done in the past. A couple years back, WPS was awarded a grant by CMS it was called an innovation challenge, and we actually had 2 proposals that were accepted. I think there were 19 submitted to CMS. 6 of them were accepted, those grants made. 2 of them were WPSs. So we were involved in an innovation challenge released by CMS to use some innovation to help beneficiaries receive the benefits that they are eligible for. And I don't think that anyone argued that depression screening is a helpful tool to both providers and their patients. So there was a lot of education, a big push that we had to increase the use of this benefit. And we were very, very successful in doing that, in part because all of the providers that listened to our education took actions to begin offering this within their organizations. It's a covered benefit. It's helpful to both the provider and to the patient to have this depression screening in place for their patients who may need it. And remember, it is a screening. Once there are signs or symptoms of depression, it's no longer screening. It can be a screening for a patient who once upon a time had a diagnosis of depression, but is no longer being treated for that depression. So history of depression. So a lot of great information here on this training page. We have, of course, our live events webpage, which is where you can find a listing of all of our courses coming up. And it says out here materials will be available 5 days prior to the presentation, sometimes sooner. You can see a lot of our events that we have scheduled are out here, but the materials aren't yet done. We have to schedule weeks in advance so people can sign up and register. The registration also provides the opportunity for providers to submit a question in advance. So very, very helpful to us, your webinar presenters, because we can look over those pre-submitted questions in advance. I think it's worded something like, what one question do you want answered during this presentation? Well, it's kind of a double-edged sword for us, actually, because we get really great questions sometimes about what we plan to talk about, but sometimes the question that comes in is not at all all related to the topic that we're planning to talk about, but we do still use that information to help us plan and provide education on other topics. So this is our live events page. Future offerings about depression screening would be listed here, or about any other education that you might find helpful. So another great tool. And then of course we have on the WPS YouTube channel. I'm going to click out there and you're going to hear my colleagues start providing some background information about WPS because it automatically starts to play. That's Tom, you hear. I'm going to turn it off. And just tell you that when you do open our YouTube channel, you are going to start hearing this webinar because it plays automatically. But we have playlists available out on our website, and I did include a direct link to this, but I wanted to show you that we do have depression screening. I'm looking for it. They're not in alphabetical order. So here's the full playlist of those previous recordings that we've done. Okay. And of course, these will go away when we offer a new one. I'm offering one today. That's the just depression screening overview. What I'll probably do, that was offered 6 months ago, is delete this one and add my new one. Okay. Why would I do that? Because sometimes I may have talked about something today that I didn't talk about 6 months ago. And that has to do with all of those great questions that all of our learners submit in advance. I think it really helps us expand on the topic and be able to better provide everything that you, our providers, need, all the information you need. All right, so that takes care of the WPS resources. We also have CMS resources, and I've talked quite a few times about the internet only manual. It is section 190. I want to show you here this chapter real quick. I'm just going to do a search so I can get to it. You can link to the chapter, but you can't link to the section. So here, folks, is where I kept talking about manualized places of service. This is what I went to CMS with, and I said, but what about these places of service? So in addition to these 4 places of service that Medicare will pay for annual depression screening, there are additional ones. And those are what Bailey put in the chat. And I also placed, or I'm going to email you about later. It's out on our fact sheet on our website. And next time CMS updates this section of the manual, they're going to add those places of service here. All right, so other links for CMS, and we're kind of getting a little bit shorter on time, so I'm just going to talk about these. The decision memo for screening, here is the link. CMS's preventive services tool. That is the tool that I demonstrated. One of the tiles in that list of that educational tool was the depression screening. Remember, it had the T with the circle around it. That's what we're talking about right there. Medicare.gov, of course, is that website for people with Medicare. And I'm pointing this out to you because this talks about the fact that this service is free. So that's why it's important that you explain to your patients if you're rendering any other coverable services the same day, that you let your patient know that this depression screening portion is free, but there might be coinsurance and deductible that applies to other services. And that brings us to some time for questions. Bailey, do we have any depression screening questions in the chat?
We had a couple come in. Let me go and find them. We have a question here. It says, will there ever be a way to check on the WPS website for eligibility for Medicare wellness or depression screening for Medicare Advantage members?
There will not, and I'll tell you why. If a beneficiary has Medicare Advantage, that is administered by the Medicare Advantage plan. We don't know anything about the plan, so we can't tell you their rules, their guidelines. What I can tell you about a Medicare beneficiary who has chosen or elected a Medicare Advantage plan instead of original or traditional Medicare, which is us, original Medicare, we're traditional Medicare, sometimes people call it, is that they must offer the same basic benefits as traditional Medicare, but they can offer more. And they have contracted with CMS to provide the Medicare, the administration of Medicare benefits for that particular beneficiary. But we don't know them, we don't have access to them. We don't confirm that they've enrolled in that. That's all part of that process that is done by that Medicare Advantage plan. So a lot of times if you call customer service and ask a question about a beneficiary who has elected a Medicare Advantage plan or chosen one, we can't answer it because we don't know that information. It's a completely different animal. Okay. So no, you will never find in our tool when the beneficiary is eligible for uh, their next service if they have a Medicare Advantage plan. We're not going to have access to that information. Okay. Another question, Bailey?
Okay, thank you for that, Mary. We have another question that just asks, can you please explain proof of thought more? Is the rationale considered a proof of thought?
As long as you're addressing in that medical record the negative findings, there are negative findings, no additional treatment planned. Just address it. Basically, we're looking for it there that you did address it. What we don't want happening, folks, is someone in an office handing the patient that questionnaire. They look at it and say, "Oh, it's negative," and then the physician or the practitioner that's billing for the service doesn't address it. Okay, they need to provide a service in order for us to make reimbursement for this. So even if the findings are negative, they need to address it. So really that's what we're looking for there. It's not just simply a nurse service when it's a negative service or a negative finding. We need to know that that healthcare practitioner who is billing um, actually acknowledged that finding as negative, okay, and determined that there was no further need for any depression treatment. Okay, there, I got that one out. Sorry about that. Any other questions, Bailey? We have a few minutes. Great
Yep,
questions.
we had one that has just came in. Depression is required for annual wellness. So if the patient is already diagnosed with that and documented, this covers this element.
Uh, you can't bill for a screening if it's already positive or there's findings elsewhere that the patient has depression. But really the reason why we don't pay for G0444 separately than the G code for the annual wellness exam, that initial one, is because if you look up the elements of an annual wellness exam, depression screening is already there. You need to do this, and this in order to pay for an AWV. So why would Medicare pay separately for a depression screening when it's already required as part of that AWV? It's already bundled in there. Okay, that's what we're talking about here when we're talking about the bundling of G0444. Any other questions, Bailey?
This one kind of goes with the one you just answered, but it says if a patient is already diagnosed with depression, can we still use the PHQ-9 and code G0444 when it applies?
No. If they're already diagnosed with depression, you're not performing a depression screening, or Medicare's not going to pay for it. It's not appropriate to bill Medicare for a screening test if the patient's already positive. There's positive findings for it. So no, we wouldn't pay for it. It shouldn't be billed.
All right, and that wraps up all of the questions that I see in the chat, Mary.
Thank you, Bailey. Thank you all for the questions. They're great questions. I'm going to tell you in just a minute how you can ask a question if you think of something between now and a week from today. First of all, though, I do want to talk about the Certificate of Achievement that WPS will provide. In a few minutes, you will receive an email to thank you for attending. If you attended by phone today and you're not using the web app for WebEx, If you're just listening to this and not seeing anything, you do not receive that automated email because WebEx can't track those phone numbers. But if you receive that email and you are looking for continuing education units, WPS does not provide you with a CEU or a number to submit to anyone, but we do provide you with a certificate of achievement, and it is going to look like what you see on the left side of the page here. Down at the bottom in the red box, it's going to have your name, the contact hours, um, and what you'll do, today's date, of course, is you'll take that email and submit it to your governing body or the agency that accredits you. Submit it to them and ask them to consider for payment. For those of you that are not payment, consider for CEUs, I'm sorry. For those of you that are AAPC members, there is a way that you can enter online and request those CEUs. And of course, you would not have the number here to do so, but they do allow you on your website to enter the information when education is provided for the MAC so that they can award you with CEUs. If you don't see that follow-up email, and it will come from WebEx, look in your junk or your spam folder. It may have delivered there. That would be my first recommendation. If so, I would recommend that you add the WebEx email address to your safe sender list. So if you attend any of our events in the future, that email will come right into your box. It won't go to spam or junk. The WebEx email is included, I believe, on the next slide, or so you'll see it. You can add it to the safe sender list. Follow-up questions. If you think of any questions, you do have 7 days to submit them. We had some great questions already. If you're like me, you go back to work and like tomorrow you think, gosh, I wish I would have asked that question when I had the chance. You still have a chance. For 7 days following this event, you can send an email to our education mailbox. It is here on this slide, wps.gha.education@wpsic.com. The subject line, if you would please mention something about depression screening, or you can put in the subject line what you see here on this slide. You could abbreviate. Basically, we need to know it was depression screening because the staff member that is opening those emails each day and looking at them and determining where to send those emails or who needs to handle it, they'll know to send it to me, Mary, so that I can provide a response either directly to you, or I will put together a list of questions and answers. Just a reminder though, if any of you have claim specific questions, so for example, if you had a depression screening that denied and you don't remember, or you don't know why rather, those kind of questions, those that are claim specific, I am unable to answer because I do not have access to claim history. So if you have a current claim processing you have a question about, or one that's been processed in the past for depression screening, I can't answer that, but I can answer the any education related questions, widespread, not specific to a claim or a provider. But don't worry, you can get help. You can call customer service and someone there will be able to help you because they do have access to the claims history information in the processing system. We in provider outreach and education do not, because CMS instructions in our internet only manual say that's customer service work. They have to log and track and resolve the questions. We in provider outreach and education don't log and track those individual inquiries. All right, I talked about this before. I'm going to make it real quick. For any of you that have attended our education in the past, you know how important this survey feedback is. We want to know if you enjoyed this experience. What did you like? Is there anything that I can improve on? The survey is also a great way for you to let us know other topics you would like to learn about. My colleagues and I all look to these survey results. CMS reads these results. Our VP at WPS is reading these results and on up the chain. Very, very important for all of you to let us know how you enjoyed today's experience. So there is this online survey. Bailey has placed the link in the chat. We are also giving you one last chance to complete that survey. When we close the webinar today, or when you close or leave the webinar, you're going to be directed to a CMS Qualtrics survey website. Looks like what you see on the bottom of this page, that yellow triangle. It's not spam or junk. It's just another option that allows you to click on that blue button and go right to that survey. And it really does not take a whole lot of time, but it is so valuable. So please, if you would do that for me today, take the survey. Let us know how we did, what you'd like to hear about in the future. On behalf of myself and Bailey and all of Provider Outreach and Education, I do want to thank you for your participation. We know you're busy, that it's hard for you to step away from your work and your responsibilities to attend these events, but we appreciate it. We look forward to your survey comments, and we hope to have you join us for future events. You may now disconnect. Have a great day, everyone.